that is the precancerous lesions, should be treated once they are seen. It's because I said that the HPV can clear itself. But now we do not know whose HPV will be cleared or whose own will still persist. So it is best that if you detect any abnormality, you just treat it, and then you are on the safer side. And then the treatment option. There's one that is called cryosurgery. Cryosurgery. When we find that you have abnormal cells, there's a cryosurgery. It's not like you go and sit down and then they'll use knives on you. No. They just use a freezing method to freeze the cells. So the cells are frozen. You know what happens when fishes are put in a deep freezer? They die. So they are not able to propagate. They are not able to develop, or they are not able to multiply. So cryosurgery actually freezes the cells and they die. Then there is laser surgery. Laser surgery, L-A-S-E-R. Laser surgery. It's also used, and it bends and vaporizes the cells. So if you bend something, it dies. And then there's loop electrosurgical excision procedure, LEAP. That one, a wire loop. A wire loop, when you go to the laboratories, especially microbiology laboratories, they have a wire loop for scraping. That loop is used to scrape the cells, and then you are okay. You understand? But once you've detected an abnormality, it means that such a person, you have the tendency of developing those ones. So you should get yourself checked the more. And then so what I said, the treatment that I mentioned is for precancerous lesions. Now what I'm going to say is when the person has already developed the cancer before going for the pap smear test. If cancer is present, then the womb would have to be removed. I told you that the cervix is the neck of the womb. If it is detected that you have cancer there, immediately your womb would have to be removed. That's unfortunate, but that's the only way out, because cancer cells can affect other ones. They can affect the womb. You can get uterine cancer. They will go on to affect your bladder, your kidneys, your rectum, and then you just die. So the best thing to do is just like you find a bad knot here, you remove that person. That is why students are sacked sometimes. You understand? It is removed. And then this surgery is called hysterectomy. Hysterectomy. There are two types. There is total or partial. Total is when your womb plus your ovaries, everything about your reproductive system is removed. And for partial, it's really the womb that is removed. The fallopian tubes and the ovaries are left there. But whichever way, you can't have children once you don't have a womb. Then depending on how severe the cancer has grown, then this may not be enough. If the cancer is just big, if it's just at the tip of the cervix, then we can just remove the womb. Otherwise, if it has started affecting other parts, then radiation therapy, that's radiotherapy, or chemotherapy treatment with drugs may be added. So that's the end of my presentation. If you have any question concerning what I have just said, I will be able to answer.
My question is, you said the HPV, is found on the skin of the genital of both men and women. I'm asking that, so in the men, the HPV doesn't cause any harm, but when it gets to the women, that's where it causes harm.
That's a very good question. She's asking that HPV can be found on both skins of the genitals of men and women. Now in the men, if you've all heard about prostate cancer, that is what causes it. So HPV causes prostate cancer in men, and then in the women it causes cervical cancer. But because we're not dealing with prostate cancer, that is why I didn't go to that side. But in men, so HPV is harmful to everybody. It's to everybody. But because we're concentrating on the women, so maybe it causes prostate cancer in men. So the men are not free as they would think. They are not free. It causes prostate cancer. Okay. So if your question is answered, another one. So those of you who have questions, you can just come and stand here so that we don't waste much time. You mention your name and then you go on to the presentation.
My name is Crystal Sebwat. My question is, does fingering also cause